today I'm back with Dr. Emma. Hello, Dr. Emma.
Good morning.
And we're going to talk about a common problem we see in clinic a lot. So lots of patients have been coming in recently with concerns like aging, acne, but allergic to ingredient X. And I guess it's just important that whenever we hear this kind of a story that we work out what's truly allergy and what's actually just irritancy, which is something that's terribly common and can affect pretty much anyone in context of punchy, powerful, active ingredients that we see in prescription skincare. Yeah. So given that irritancy is the commonest situation, let's just talk through what does that look like to you?
So irritation for me is when somebody's been using something that causes some dryness, flaking, and generally the skin is a bit more sensitive. And that's because the products that you're using may cause changes within the skin and just strip the natural oils out of the skin and result in actually the skin becoming quite irritated. Mm-hmm. Whereas allergy, on the other hand, is when your own body is reacting against a particular ingredient. So it's recognised the ingredient as being sort of foreign or harmful, and it's launching an immune response to that. And it's really important, like you were saying, to distinguish between these two, because otherwise you may get into a situation where you're using something just thinking, oh, it's just irritating, but actually you are allergic to something and it's causing more and more problems as you're using it.
Yeah, I think that's true. So I think certainly in terms of making the distinction, I think the story is often kind of a bit of a giveaway. So there's often a story with irritancy, a gradual increasing dryness and tightness and discomfort in the skin with visible flaking and maybe some redness over time. And on stopping the product, that's likely to be the causative agent, things get better, and that they would be comfortable with reintroducing that same ingredient again, but would just have to go more slowly. And I think that the common things we certainly see irritancy to would almost be normal in a way. Retinoids, we actually acknowledge that there is something called retinoid dermatitis because we know they can be drying, but in fact this is just a normal process of getting used to this active ingredient, and it would improve with time. Benzoyl peroxide can do it, AHAs can do it, so lactic acid, glycolic acid. Those are certainly the common ones I think that people will be using on a regular basis. Whereas, as we said, it is more typical that if you're becoming allergic to ingredients like fragrance and preservatives. And the pattern tends to look different. It's more severe, isn't it?
I think it is more severe. We tend to see that there's a true eczema. The area can be quite swollen. It can sometimes be quite uncomfortable. Yeah. And sometimes those allergic reactions can actually be very severe. But it may creep up sort of insidiously as well. And then you just find that you keep on using it and this eczema, dermatitis or inflammation continues to come out. So I think it is more severe than irritation. And like you were saying, different products actually cause problems with allergic contact dermatitis, fragrances, preservatives. There's something called MCI, which is a really common one. So I think those two are quite important distinguishing features. And with allergy, if you have become allergic to something, you stop everything for a bit, but then you reintroduce it, you're likely to get quite a significant reaction again. Yeah. So for me, those are the main distinguishers between irritancy and allergy.
Yeah. So I think that it can be subtle. I think just to be clear, it can be subtle and the distinctions can be hard to make. So yeah. I think that the practical way to manage a reaction is to stop the things that you're using, to start again just using what we call clean products. And I think that Aven and Roche-Posay do offer products that are both fragrance and preservative free. Get your skin comfortable again using a very non-provocative basic routine. And then the thing to do is to reintroduce your actives one at a time.
One by one, of course.
And otherwise, to go slower and to go more gently than you previously did with it.
I think that's the other problem with multi-step regimes, that actually you don't really know what's causing the irritation, what's causing any sort of problem. So like you were saying, introduce one by one, keep everything else constant, keep with a clean regime and introduce things one by one, slowly building it up.
So I think that with an irritant reaction, if you go slower and use less, so if before the problem was happening after every other day use, you might try every third day use, so just twice a week, and you might use less. And if that was working okay for you, the chances are you did have an irritant reaction, and allergy is less likely. Whereas with allergy, if your symptoms come back, boom, on reintroduction, you know you're probably going to need further investigation.
Yeah, and that's where dermatologists come in, because we can actually test for individual reactions, but the only way by doing that is by actually applying them at very low concentrations on the skin, and that's something called patch testing that has to be done by a specialist.
I think that's it really. I think it is tricky. I hope we've given you some basic guidance as to how to distinguish between these two patterns. Irritancy is much more common. But I think if in doubt, a dermatologist's input in putting a skincare together for the first time can be very valuable for these sorts of reasons, because there is a little bit of, you know, trial and error with some of these ingredients, and if you have sensitive skin, it may well be the safest route to go.
And it's really important because the single most common reason for creams not working in terms of acne or anti-aging is because people actually find they irritate. And so actually really learning to understand your skin and understand how you can introduce these things makes all the difference between having a successful regime and one that really doesn't work at all. So
yeah, good points. I hope that was useful and look forward to seeing you next time. Bye for now.